I like this lighting in the car. That's why I wanted to make a video. So I'm about to head out for a few errands on a Friday, and I thought of a particular case. Someone left a really nice review, and I'm very thankful for it. It definitely makes it all worth it when you go to the office and you're getting to be able to give that to people. And so I was thinking to myself, like, what if someone has severe lower back pain and they don't get better in 2 or 3 visits? What then, right? It's not about getting better in 2 visits or 3 visits, or it didn't work, or it's not about 6 months later back pain went away. Because I was just listening to a podcast today of somebody who was playing, what were they doing? It was like they were playing like t-ball, or like they were playing some kind of batting practice game where one of the guys was a former high school athlete, and then the guy pitching was actually a former Major League Baseball player. And so he had been throwing like 80-mile-an-hour fastballs, and the guy just kept getting hits. The high school athlete just kept getting hits off the former Major League Baseball pitcher. And then the Major League Baseball pitcher threw like a 70-mile-an-hour curveball where it kind of like dropped down, and the guy swung out of his shoes, and he like tweaked his back, and he said he was hurt for like 6 months before he got back to stable. That's a long time, and it sucks. I mean, I've been there. And so what I was thinking is, it's just, we're all just so different. We're so unique in the way that our pain, neuronal firing patterns happen, depending on like the joint, depending on the pre-existing injury, depending on the reason that now you have this sprain, strain, or disc bulge, disc herniation, all these reasons that this could be happening. And then it's like finding the stimulus that works best for you and finding like the dose response. It is so unique to everyone out there that you should try your best not to compare your injury to somebody else's injury. You should not try to compare your pain to somebody else's pain. And really, it's working with somebody who can kind of figure out the best way to handle your pain case, your care, and then at least giving it ample time. And now, what does that mean? I want to end this video by saying, like, what does ample time mean? What does it look like? I would say within a 2-week period. So that means you're, 14 days into working with somebody. Maybe you've been there 5, 6 times, 7 times, something like that. Maybe less. And if it's just flat out not changing, if it's getting no better, then obviously, I'll be the first one to say seek elsewhere. But if you're making a decent amount of progress, especially if there's other modifications you can make, like, are you on medications that maybe have side effects? Is your diet just absolutely terrible and you're dealing with a lot of other inflammation and like GI related symptoms and headaches possibly related to diet? Or maybe there's also something you're doing that's forcing you, whether it's work or athletics, to stay in a position that's really making it worse, that you just simply can't continue to be in that position. And if you can kind of rule out, some factors, and then again, after 2 weeks, you just haven't been getting better, seek alternate type of care. And that's my message for this morning. So thanks, everybody.